Hello, everyone. Welcome to Health Series Podcast. Today, we're going to be looking at the topic healthcare system of Nigeria versus that of Canada. Comparing Nigeria's and Canada's healthcare system highlights significant differences in structure, funding, accessibility, and outcomes due to distinct socioeconomic environment, governance structure, and healthcare priorities. In the area of healthcare structure and delivery, Nigeria's healthcare system is a mix of public and private services. The government provides healthcare through a tiered system with primary healthcare centers, secondary hospitals, and tertiary hospitals managed by federal, states, and local governments. However, private healthcare is also prevalent, often being the preferred option for quality care, though it can be costly. On the other hand, Canada has a single-payer, publicly funded healthcare system known as Medicare, funded at the provincial and federal levels. Each province administers its own healthcare system with universal coverage, ensuring that residents have access to necessary medical services without direct charges. In the area of funding and insurance, healthcare in Nigeria is primarily funded through a combination of government budget, out-of-pocket payments, and private insurance. Public funding is often limited, leading to under-resourced facilities, while a large portion of the population lacks health insurance. Nigeria has the National Health Insurance Scheme, NHIS, but it covers only a small fraction of the population, largely living rural and low-income communities uninsured. On the other hand, Canada's healthcare is tax-funded, ensuring universal access for all residents. The federal government provides funding to provinces through the Canadian Health Transfer, with the provinces responsible for their healthcare expenditures. Most Canadians receive free or low-cost care, as the system covers most essential health services. When looking at access to care, access to healthcare in Nigeria is often limited by geographical and economic factors. Rural areas have fewer healthcare centers, and many urban facilities are overcrowded. Patients in underserved regions face long travel times and high out-of-pocket expenses, creating barriers to timely and adequate care. On the other hand, Canadians' healthcare system aims for universal access, though remote and rural areas sometimes face physician shortages and longer wait times for non-emergency services. The country has initiatives to address rural access issues, though disparities still exist. In the area of healthcare workforce and infrastructure, Nigeria faces a shortage of healthcare professionals, with many of the doctors and nurses immigrating for better opportunities in UK, US, and Canada. Facilities often lack essential equipment, medications, and adequate infrastructure, particularly in rural regions. The shortages of professionals and resources significantly impact quality of service. Whereas Canada has a comparatively well-distributed and robust healthcare workforce, though rural and indigenous communities can experience shortages, Canadian facilities generally maintain high standards of care with access to advanced technologies and resources. However, there are ongoing challenges with staff retention and workloads, especially in smaller communities. In the area of healthcare outcomes, of course, Nigeria faces high rates of maternal and child mortality, infectious diseases such as malaria and tuberculosis, and non-communicable diseases such as cardiovascular diseases, cancer, and the rest, exacerbated by limited access to quality health. Preventive care and health education are improving, but significant progress is needed to achieve better outcomes. Whereas Canada has stronger healthcare outcomes relative to global standards, with lower rates of maternal and child mortality and a focus on managing chronic and non-communicable diseases, Canadians enjoy a life. On the other hand, Canada has strong healthcare outcomes relative to global standard, with lower rates of maternal and child mortality and a focus on managing chronic and non-communicable diseases. Canadians enjoy a high life expectancy, but indigenous health outcomes remain a concern, prompting effort for more culturally sensitive healthcare programs. Having looked at some of these similarities and disparities, I think it's important for us to also look at the health challenges and innovations comparing Nigeria with Canada. Nigeria's main challenges are funding, healthcare accessibility, and quality. Efforts to innovate include telemedicine initiatives, mobile health programs, and improving NHIS for wider coverage. International support and partnership are also essential to address infrastructure and resource shortages. On the other hand, Canada faces challenges with wait times, especially for elective procedures and ensuring access to in remote areas. Innovations include e-health systems, virtual care services, and expanded mental health support to reduce wait times and improve service delivery. In the area of government role and policy approaches, the Nigerian government plays a role in setting policies but faces limitation in enforcement and funding. Efforts to improve healthcare are often supported by international organizations and NGOs, which provide additional resources and expertise. On the other hand, the Canadian government is highly involved in setting healthcare policies, with provincial governments implementing them. There is strong regulation and oversight with ongoing effort to improve healthcare access, especially in underserved areas. In conclusion, Canadians' healthcare system emphasizes universal access with public funding, whereas Nigeria's system is mixed with challenges in accessibility, funding, and resource distribution. Nigeria is striving to expand coverage and improve outcomes, whereas Canada focuses on optimizing access and managing rising costs. Would appreciate if you like this video and subscribe to the channel so we can reach more listeners like yourself. Until next time, stay informed, stay healthy, and continue exploring the world of healthcare with us. Thanks for listening.
This podcast is sponsored and brought to you by HealthShare Integrated Solutions.